So we've got a lot of people here now, and I think I'm hoping that we're fitting in with the organisers for starting. Thank you, Blair. So I think I've got the cue from Blair Smith, thank you, to start the session 1. We're a little bit late, but we're going to run very slightly into the break as written in the programme. But after that we'll catch up. So by 12, there'll be the next session. Can I introduce Lena, who's going to be talking to us about the role of executive functioning skills in understanding chronic pain experiences in adolescents. This is a pilot study, and we look forward to hearing from you, Lena.
Thank you so much. So thank you for that introduction. Indeed, I'm excited to share some of the pilot study results of this study funded by the Royal Society of Edinburgh. So I first wanted to talk a little bit about why executive functioning, why did we decide to focus on that? And executive functioning is the capacity to coordinate your thoughts and behaviors. And we see 3 core components in that. One is inhibition, or for example, if you're in a social situation and you want to express a certain response, but you do realize it's not really appropriate, you have the ability to actually withhold that response. Working memory is the second component, which an example is that, for example, you need to take medication every day at 4 o'clock and you need to keep that in your memory so you don't forget to do that. And cognitive flexibility, that kind of refers to the ability to have a variety of solutions in your mind to solve a problem, so that if one doesn't work, you have a variety of different options to try out. And we know from various chronic illnesses that these kind of skills are pivotal to successfully self-managing your illness and the symptoms associated with your illness. However, if we're talking about adolescents, so this is a focus of our study, we also realize that these skills are still growing and developing in adolescents and actually show quite an erratic growth, in the sense that some skills are improving early in adolescence, but some show a dip and actually reduce in improvement. And then finally, by around young adult age, we see that they're having an optimal level. So why is this relevant in the context of chronic pain experiences in adolescents? Well, we see that in adolescents, there's a reduced engagement with pain treatment approaches and adherence to these treatment approaches. Adolescence is the worst stage in the lifespan where we see this kind of engagement and adherence to pain treatment. And we anticipate that this might have something to do with those still developing and erratic executive functioning skills. Not only are they still developing and are they erratic, we also know from other research that chronic stressors can actually further impede or delay this development of those skills. For example, we have evidence from adults with chronic pain that there are deficits in executive functioning. But there's limited longitudinal research to really understand why this is the case and what comes first. Is it first chronic pain? Is it first delays in executive functioning skills? So there's still lots that is not understood in this association. In addition, there's very limited research in this crucial stage of adolescence where these skills are still developing of what is going on. But we do believe that based upon the limited available evidence that adolescents with chronic pain might be at risks for extra impairments in executive functioning, and which could potentially explain those reduced engagement and adherence to treatment. So to stimulate further research in this from a theoretical standpoint and theoretically driven, we developed the COPES model, which kind of explains a circular relationship between reduced or immature executive functioning skills and their engagement to engage with self-management behaviors or pain interventions, which if you have reduced skills, you have a reduced ability to engage with self-management, which further increases your chronic pain and pain-related disability, which kind of further adds to the reduced capacity of your executive functioning skills. And in the blue boxes, you see that we have highlighted a few potential moderators and mediators of this association. And we are hoping that this theoretical model might stimulate further understanding and further research into these associations and either prove or disprove the associations we have brought up. And the pilot study was a first step into that to kind of investigate if a multi-method approach comparing executive functioning skills between adolescents with and without chronic pain is feasible. So we had 3 questions we were hoping to answer. Is this a feasible approach, this multi-method approach? Is it acceptable to participants? And this is an easy question to answer even before I go into the details. Yes, it was feasible. Participants engaged quite enthusiastically and didn't report any extra burden. And we actually recruited ahead of time. So it seemed like it was something participants wanted to participate in and were interested to participate in. Our 2 main research questions were if adolescents with chronic pain actually report and show a tendency for lower executive functioning skills compared to those without chronic pain, and how these associations are affecting their quality of life. So what did we do? We had 22 adolescents with chronic pain recruited from the pain clinic in Glasgow. The majority were female, as we would anticipate from the demographic in the clinic, and they were about 15 years of age on average. We also had 13 adolescents without chronic pain that we recruited. Those were matched for age and sex to the 13 adolescents with chronic pain. And we had a multi-method, multi-informant cross-sectional design. The multi-informant means that we have data from both the adolescent and the parent, but today, for the sake of time, I'll only be reporting on the data of the adolescent. Multi-method means that we had both self-report and neuropsychological assessment of executive functioning skills. So we assessed all 3 core components with a variety of neuropsychological tasks, including some tasks of the WISC and the WISE and the Dallas-Kaplan executive functioning system. But we also asked the adolescents to rate their own ideas about their executive functioning skills using the validated behavior rating inventory of executive functioning. Chronic pain was self-reported using the PROMIS pain intensity and interference scales, which you can see an example of on the slide. And quality of life was also self-reported using the general PET scale, which asks in the past month if they had any problems with physical functioning, social functioning, emotional functioning, and school functioning. And the general, there is a pain-specific PET scale one, but we chose to use the general one so we could compare with pain-free adolescents. So with respect to our second research question, do adolescents with chronic pain report and show a tendency for lower executive functioning skills? The answer is yes across the board. So we have a variety of ways of testing this. For our chronic pain sample, so the 22 adolescents, we had norm scores on the neuropsychological tasks we could compare with. And there we saw that it depends on which skill we're looking at, but for every skill there is at least 30% of adolescents who show a deficit in their or a problematic performance, and the biggest group as having a problematic performance with that cognitive flexibility, so showing that they can have multiple solutions for a problem. In self-report, we see similar findings. So with the norm comparison scores, again, depending on the specific skill, slight differences, but about a third to half of the population was of our sample was reporting that they have difficulties with those skills. And in the self-report, it was mostly the working memory they reported difficulties with. So the potential to keep things in your mind and to remind yourself to not forget things. But of course, we also had our own group of adolescents without chronic pain that we could compare them with, which was matched on age and sex. And there we see similarities. So for the neuropsychological testing, for all 3 components, we see that our adolescents with chronic pain had substantially significantly lower scores than the pain-free adolescents, which was slightly surprising to us for such a small sample to already see significance. But we had significant differences for those 3 core skills. And in self-report, the working memory was again showing up as the most different between pain-free and adolescents with pain. We also saw differences for cognitive regulation, or that cognitive flexibility, and a total score for executive functioning skills. So for self-report, we don't see any differences for inhibition. And this was in turn also related to their report of pain intensity and interference. So lower scores, both self-reported or using the neuropsychological tasks on inhibition and cognitive flexibility, were related to more report of pain intensity and pain-related interference. So how does that affect their quality of life then? So we saw that quality of life was strongly correlated with all three executive functioning skills. Again, whether the assessment was through self-report or neuropsychological tests, we saw the same outcomes. So lower scores or problematic performance on executive functioning skills is related to lower quality of life. And lower quality of life, as we know, is quite strongly correlated. This is nothing new to pain and pain-related interference. However, we did not find any interaction effects between the pain experiences and the executive functioning skills on quality of life, but this might definitely well be because of a small sample that we were not powered to find those. So in conclusion, we have preliminary evidence that adolescents with chronic pain show reduced executive functioning skills across all three core components of executive functioning. But this is very early days to make any strong conclusions, and we feel that we need prospective longitudinal investigations which start early in adolescence to comprehensively test those assumptions we have made in the COPES model and also their clinical implications. And we see three key kind of ways forward. We need to know what the different developmental trajectories are of executive functioning skills between adolescents with and without chronic pain. We need to know more about the mechanisms through which executive functioning skills is then explaining their ability to engage with self-management, and whether there is a moderating role or not of parental support. If the parents provide effective, flexible support, this might well overcome some of these difficulties that we see in executive functioning skills. And I'm hoping to be able to do this work in the future. There's currently a grant application submitted to do this work, so fingers crossed. And thanks, of course, to the Royal Society of Edinburgh, Glasgow, and my co-investigators, and everyone who has participated in the study.
Thank you very much, Cass, for an interesting presentation. There's an opportunity to write questions in the chat box for people in the audience. May I start off and ask one? I've got one from David Walsh. I think you should go before me, David. So I'm not sure whether you can read this, Lena, but David's asking, do you think that people with impaired executive skills are a risk factor for developing chronic pain? Or accessing services, or do you think chronic pain impairs executive skills, or both?
That is a very good question, and I don't necessarily have the answer, and that's why we are hoping to do some longitudinal prospective studies to be able to kind of identify what the direction of the finding is, because so far we have only cross-sectional results, and so we don't know in which direction to interpret and what's the causality. So we don't have evidence for that, but my kind of, I would say, gut feeling from doing the pilot study, and I did all the data collection myself because this was a sabbatical grant, so I was given the time to do that. And that was really lovely and also interesting because I could talk to the patients and the parents and get some more informal information. And to my feeling, for most adolescents, the executive functioning delay and difficulties came first. And the chronic pain came second. So they had some issues with executive functioning skills before they developed chronic pain, and it did make it more difficult to access services, to deal with their pain, to understand where the pain was coming from, to know what to do to manage the pain. So, but this is very informal, so I can't put this black on white, but kind of my anticipation, if we are able to do the prospective investigation, is that we will find that probably problems with executive functioning skills might come first and invoke kind of this kind of risk factor to develop chronic pain and have difficulties accessing services if you do.
Thank you. And Leslie Colvin is asking, did you look at medication or indeed non-prescribing drugs or alcohol use in your participants? And was there any difference between their groups?
Yep. So we did indeed, and there was no significant differences, to be honest. So most adolescents with chronic pain were on some kind of pain-related medication, of course, while the adolescents without chronic pain would have not been. But other than that, they weren't on any kind of medication that we would anticipate to reduce their executive functioning skills. So we wanted to control for that because we know some of those might have side effects. But the ones they were taking for their pain were not, to our knowledge, influencing their executive functioning skills. And beyond the pain medication, there weren't any kind of substantial differences between the medication they were taking. But good question.
Thank you, Lena. We're going to have to move on because time is pressing. And may I ask you to switch your camera off, Lena?
Yeah.
And Cass, are you there and have you got your slides to share?
I am. Let me just see if I can remember how to load them up.